Marianne. It was great hearing your speech today. So this is Marianne from the Poverty Action Lab, and today she spoke about behavior and how it can help impact, how changes can help make much bigger impacts. Could you give us a little description about what you talked about today?
Sure. So we work in conducting experiments around the world and here in the U.S. to figure out whether a specific program, whether it was a tutoring program to help kids learn or a health program to help people keep their children safe and healthy, we measure whether they actually worked in a specific case. And what I was talking about today is kind of the next step beyond that. So you learned that a specific program was really effective in Udaipur, in one state in India. How do you know whether it's going to work somewhere else? And I tried to explain how we can not just throw up our hands and say, well, every place is unique and different. So just because it worked in one place doesn't mean it's going to work somewhere different where the context is so dissimilar. And try to take a step back and help people understand what kinds of questions to ask to figure out whether something that worked in a different place is also likely to work for you.
You were saying how your lab in the field has generated a lot of info and conclusions about this. And is there anything more you can say about that and how you hope to utilize it some more?
Sure. So, we and others who are doing these kinds of experiments have now done hundreds of studies. Those affiliated with our lab have done almost 900 across education, environment, governance, health, lots of different areas. So the growing body of evidence on what we know works and what we know doesn't work is really becoming much more robust. But it's still the case that if you're in a particular city, it's very unlikely, if you're thinking about rolling out a new program in your schools, for instance, that exact same program has been tested in your location already. And sometimes people kind of have this hopeless response. We're like, I don't know, it hasn't been tested in my school. And I've heard superintendents tell me exactly this. If it hasn't been tested in my district, how do I know whether it's going to work? But we've seen cases where a tutoring program, the same concept worked in India and in Chicago. And we can learn across really, really different contexts when we don't focus on the location so much, but focus on the underlying reasons for why a program worked and what underlying problem it was trying to address.
In your speech today, you spoke about how there was issues with vaccinations and how a small change can really help improve that. Could you speak to that a little more?
Sure. So, this is essentially a last mile problem, right? We have vaccines that have been developed for diseases like measles, for instance. And the vaccines exist, and they have been, sent to village subcenters in different parts of India. This is the example I was describing from Udaipur. And the vaccines are there. But before we started working there, over 95% of the kids in that area were still missing some or all of their shots. So it's not that the vaccines didn't exist. It's not that the vaccines weren't there. The problem was making sure that people go back again and again until their child was fully immunized. And we saw that a very small nudge, just a little bag of lentils each time, really changed people's behavior because it gave them a reason to act today. And we all put things off, right? This is a common human behavior, and we've seen many different contexts that, those small incentives can really make a difference.
Yeah, I thought that was a great example to what you were saying, that we don't need to focus on the location. It's more the action and how it can be modified.
Yeah.
Was there anything that you wanted to drive home, or a point that you thought really resonated from your speech that you wanted to reiterate?
Yeah, so I think, the point I'm making is not that everything that's tried in one place is guaranteed to work somewhere else. We've also seen cases where a program that was tried in one place, shouldn't be tried in a new context. But overall, I think there is a place for being a little more optimistic about whether evidence from a different location can actually be relevant for us here. And if we kind of open our eyes a bit more and say, maybe we can learn from other places, we can have the potential to really have effective ideas spread much further, which is the whole idea behind TED. So it's very exciting.
Definitely an idea worth sharing. Well, thank you, Marianne. Yeah.
Thank you so much.
Thank you.